So welcome again. This is our second series with Recovery Advocacy Project. We did an Advocacy 101 kind of introduction to advocacy a couple months ago. Anybody that was not able to join us, please reach out to us. It was recorded and we would love to share that with you. And today we're going to do Share Your Story. So a little bit about the partnership. Many of you might know us as the Partnership for Drug-Free Kids. We merged with the Center on Addiction about 2 years ago. And I can tell you in the past 2 years, it's really been a wonderful marriage to take all the family supports, direct services, and for families, and then have that backed up by evidence-based science and the research of the Center on Addiction team. Both organizations have been working separately for 30 years. So really wonderful for us to come together. Next slide. So a little bit, and I'm going to try to get rid of my box here. A little bit about our work. I'm not one to read slides, so if you can, just engage in this. Really, the message here is we at the partnership, we can't do this alone. We know that if we are going to support our families, our constituents, and really just save lives, we need to be a team and collaborating with many different partners. And so you'll see this circle here. We partner with schools, with researchers, policymakers. We're never one to work in silos. I think our constituents deserve better. Today's a perfect example with RAP, just two teams coming together. So we could go to the next slide.
All right, I'll just chime in for a minute. Hello, everyone. It's good to see you all. I see familiar faces and new faces. I love that every time. I love that there's about 100 people on here right now. And so my name's Aaron Kacharski. I'm a person in long-term recovery, which means that I haven't had a drink or drug since September 6th of 2003. And I do some work with Recovery Advocacy Project. And our focus is thinking and acting locally. And we work to create both community and legislative-based solutions around what's happening on the grassroots level. So we hold a lot of listening sessions. We listen to people in recovery from all pathways, family members, harm reduction advocates, mental health advocates, and then we work to create campaigns based on what we're hearing. And so, Recovery Advocacy Project in South Carolina looks different than Recovery Advocacy Project in Alaska and Illinois and Rhode Island, and it should. Because people are experiencing all different types of issues. And so we generally work with local and state elected officials as opposed to federal. And so we work that's just kind of our organizing philosophy. And we've seen some other movements build that grassroots support using that organizing philosophy. And so we subscribe to that. And we had a lot of events last year, whether it's a training or a listening session, and we'd always have family members come in and just kind of say, hey, am I allowed to be here? And the answer is yes, always. We want, it's important that recovery advocates know what inspires family members, and important for family members to know what inspires recovery advocates. And we are all one community. And so I just wanted to put that out there. And Denise and I have worked alongside one another for years, and so I'm grateful for. I'll be chiming in a couple times throughout the presentation today, and I'm sure we'll have plenty of stories and some of the victories we had organizing with one another. So I'll pass things back to Denise.
Thanks, Aaron. And bad Denise, I get nervous doing these webinars, even though I've been trying to do them for years. I forgot to mention Denise Mariano. I am the Director of Family Supports and Advocacy, but more importantly, I'm a mother of a son in recovery, and why I began advocating. So I'd like to drop that in because I might do some anecdotal commentary too later. So our first slide, why share your story? We figured this out in two different pathways, right? The first one is more personal. Your story can bring hope and encouragement to others. help your own recovery. And let's take those two pieces first, right? How many families on here have felt isolated and alone, and maybe that their story was unique? And sadly, you know, as time goes on and you travel this journey, you realize that there's hundreds and then thousands and even millions of other families that have traveled in similar but different shoes on their journey. I could, you know, remember, and Aaron said, you know, we've been working a long time, hearing that first family share their story. And I remember sitting there saying, wow, I wish I could do that. And here I am doing a webinar when I didn't even think I could share my story. So, but it really did inspire me and help me kind of figure out a path how I can help families. Certainly helps to reduce stigma. When we talk about our personal experiences, our truth, what that journey really looks like. Too often, I think families are lumped in, and why, again, I love that Rap is here with us, that, you know, one size fits all, you know, that families are enablers and codependents and really can't be part of the solution. I think when we share our stories and they see us sharing that anecdotal part of it, just really promotes that understanding and empathy. And we certainly change hearts and minds. There's no doubt about that. We can talk about testimony later, but to sit in a, you know, in a congressional hall or up on the Hill or even a really small community event, we do change hearts and minds. We bring addiction to life and you know, humanize it. So and that's when that new perspective comes on, right? That others sitting in the room, maybe they're inspired, maybe it's a stakeholder saying, wow, I really never understood addiction, like this really hit me, I want to get more involved. So next slide. Another way of sharing our story is to inform public policy. Marcia, are you on? Do you want to take this slide or?
Yes, I am.
Okay, great. Thank
Thank
you.
you, Denise. And hi, everybody. I'm Marcia Lee Taylor. I'm the Chief External and Government Relations Officer at the Partnership to End Addiction. And this, what I'm going to talk to you about data and stories really being the secret recipe for policy change, really comes from my experience working on Capitol Hill for 11 years and sitting in a lot of these meetings and knowing that if you want to affect policy, you have to have that personal story. It has to match the data, but it really has to bring the data to life. You need that. You know, the data is really important to set the stage, let people know how big the problem is, let them know that you're not the only one experiencing it. But when you leave that meeting, it's really going to be your story that people remember and the way your story made them feel. So just want to urge everybody to know that it's a really important part of policy change.
Yeah, I do want to just chime in on that sort of piece too, where you know, I ran a advocacy program in New Jersey for about 8 years, and every year while the budget was going through, you know, the legislators were figuring out where money goes, and of course, money goes all over the state. And so, how do you prioritize the issues that you care about? And year after year, we would send advocates to provide 3 or 5 minute testimony or do a written statement. And so many times the legislators would say, hey, I remember your story from last year.
Mm-hmm.
You know, and I guarantee they might have forgot the stats that the person put out there, but those stats the data can be helpful to elected officials, staff. But the balance of using your story to make the point and have some of that that data backed up by lived experience, and finding that balance there. So I will pass things back over to Denise and Marcia. I just wanted to add that they remembered people's faces and people's stories.
Mm-hmm. Thanks, Aaron. So we could go to the next slide, Garrett. Are you ready to share your story? This is some self-reflection. I think this is a really important slide. We get to talk to you on both at the Partnership and Recovery Advocacy Project. So many volunteers coming in the door and wanting to share their story, and feel really blessed to have that opportunity and to build and trust these relationships. And what we found in just having those conversations is sometimes it just feels sticky and it still feels uncomfortable and emotional for families, right? And so that's why we're asking you, as you process this, for those that have not shared your story, to understand where are you on the journey. Sharing your stories can be triggering, or maybe picking a moment in your story, because we'll talk about this later. You typically have like 3 to 5 minutes in person. We'll talk about writing as well to share your story. Maybe it's more, you find more comfort in talking about, that naloxone piece or that, MAT piece instead of, the overdose, right? It could be too personal right now. And it doesn't mean that might not be your future story, but again, it's just some self-reflection. And consider the reach of your story as well, whether you're sharing with media at an event. Obviously, if you're sharing with media, it's going to be out there to the entire public and probably never go away, versus a small community. Next slide. Remember whose story it is. This was, I'd like to add some personal anecdotal into here, really hard for me. So much of my story, the way I would originally think of that story, was our son's story. And so I had to not only respect, his story because it's his story, but really think and reflecting back on my journey and asking you to think, what were the challenges that you faced, right? So, and we want you to just consider other family members, right? Get that consent, maybe your loved one doesn't want their whole story out there. Maybe they're worried about their future and jobs and so forth. And think ahead. I just mentioned this minutes ago, but social media never goes away, right? Anything you put out there is probably out there forever. And then just think, what would you disclose that could harm your family member? And so it's not just your child, maybe it's your spouse, right? Maybe you have a local, community company that serves the entire community, and you're worried about serving that community after, right? Maybe there's people out there that just don't understand addiction. And as we know, it's very stigmatized, right? And now they're like, wow, you know what? I don't think I'm going to use their services anymore because of the lack of education. So just a really important reminder that this is our story. We can go to the next slide. And next, we're going to go one more, Aaron. Thanks. What if you're not ready? A couple things. We wanted to share with those of you that didn't know at the partnership, maybe you're still in that deep struggle with your loved one, right? Contemplating, do I share my story or not? But maybe I need a little bit more support. So we wanted to share a few resources with you, and then Aaron will also share some. These are the services that we offer free to families at the partnership. We have a helpline staffed with lovely social workers, master addiction specialists, but also trained in CRAFT and MI and ACT. This is often where families come through for the first time, really kind of found that courage to talk to somebody for the first time, and a place where they don't feel shamed and judged. And we help them problem solve. Maybe that's a resource, maybe that's just listening to them. It's really the first time that someone is sharing and feeling cared about. Our site alone is just so much meat there. Different, how to navigate the treatment system, the parity, you name it, it's there. It's 30 years of really good content there. We have a help and hope by text, which is tailored messages when you sign up. Maybe that family member is not ready to call and make that phone call to the helpline. Some of us that have been on this journey, reflecting back, like, when was that first time this felt just so big? It was bigger than us, right? And maybe I'm not ready to call. So we'll send you links to these resources after. We have e-learning modules. The nearest and dearest, selfishly and personal to my heart, is our peer-to-peer coaching program with parents. For those of you in recovery, very similar to a recovery support specialist. We do one-on-one peer support for families coming through our doors, and letting them know that their family member doesn't have to hit rock bottom, but and that the family can be part of the solution. And we also have online support community meetings, I believe 4 nights a week now. So those are just a few of our resources, which we will send along to you. Next slide.
Wanted to, I'll chime in for this slide here. I've been advocating for 13 years publicly on recovery, but for about 3 or 4 years, I was silent about it. And I think that that's okay, right? I think everybody comes at this at their own pace. And I kind of want to echo what Denise was talking about, where it's all good for all of us to kind of self-reflect of like, is this healthy? You know, for me to disclose and talk and tell my story right now, I think that is really important. So if you're not ready, there are ways that you can. We have resources at recoveryvoices.com. We have how-to manuals in the advocacy guide. One is how to effectively speak out as a recovery advocate, and that includes messaging for family members. It includes messaging for allies and supporters, right? And so you can always go there and check that out and kind of practice. And then we have how to provide public testimony, and then soon we're going to have how to write an op-ed and letters to the editor. And so, like, I personally was most comfortable initially writing my story and like kind of crafting it. You know, I would go to articles around addiction and look at some of the comment sections, and I would practice there before I was comfortable speaking out publicly to an elected official, or, you know, like a local mayor or a police chief or whatnot, about my story. And so I would recommend that if you're not quite ready yet, and this is just the beginning, and you know, I respect exactly where you're at in that, and so it's okay to be there for as long as you're comfortable. One thing that could help is to practice writing it out a number of times, but also you might have somebody that you trust that you can say, hey, I'm thinking about doing some advocacy work and telling my story publicly. Would you mind, you know, listening to me for the next 3 to 5 minutes and providing your thoughts, and doing that over and over. And one of the things that I had to think about, actually, I'm going to talk about this on a future slide, so I'm going to cut myself off and pass it back to Denise. But you know, practice in a way that you best learn. You know, in the way that you learn best, practice in that way.
Great. And so Aaron stole my slide too, but I'm so glad. No, I'm just kidding. I can't reiterate what Aaron said. Practice, practice, practice. I know we hear that often, right? And often it's times where it's not even like, I know my story, right? I know my truth. How am I going, you know, what do I need to practice it for? And we'll get to this later on, but it's like, how do I take a 10-year journey and focus it? And we'll talk about that, right? And as Aaron said, look for those safe opportunities to share your story, you know, commenting on a New York Times article, or maybe it's just your local newspaper, or as Aaron said, you know, find that issue or trusted organization that really cares and understands addiction, and comment. That is also the beginning of really getting to meet people, believe it or not. I can remember, you know, commenting on my first, you know, article, being very scared. Like, do I, you know, should I be commenting here? Who am I? I'm just a mom. And it's how I was introduced to other people. Speak from your heart. Don't be afraid to be emotional. Authenticity and important. I added this bullet in after speaking with so many families, but also understanding this was part of my journey too. You know, for so long, I thought I was worthy of not doing public speaking because I couldn't keep myself in check. You know, first came the rumble, and then sometimes came the tears. That's okay. And, you know, do we want to cry through the whole thing? I remember the first time, and I like to share some comedic stuff every once in a while, that I said, wow, I got through something without crying. And I truly thought that I did, only to be reminded that I had this huge HD screen, like 500 by 500 feet behind me. And people, caught that tear coming. It's okay. It's our truth. It's our story. And it really shows, that human connection. Another way, Marsha, are you on? If you want to speak to the user-generated content, I'm not sure if you're on or not.
I
Okay,
am.
perfect.
Sorry, I was having
Okay.
some internet issues before, but I am back. Yeah, so I know that there are a lot of places where you can put up your own stories. So again, based on, building on what Erin and Denise said, you offer up what you feel comfortable offering up. You don't need to offer up the full story, right? And so I know on our website, and there are a lot of other websites that have similar features, you can put up your own story and a picture of your family, your loved one. Ours is at hope.drugfree.org. And we have memorials and we have stories of hope. And they're really there to be a testimonial with whatever you feel comfortable sharing. So oftentimes when you're really ready to get out and be public about it, that can be a good way to do it. And you can protect your anonymity and your family's anonymity if you want. You can just give a first name and a last initial or a nickname or whatever you choose. But it is, kind of a safer way to get out there and begin to share what your family has experienced.
Thanks, Marsha. We can go to the next slide. Framing your story. We kind of, Erin and I mentioned this a couple times, right? That often, especially when it's not in writing, but that in-person share of your story, whether that's at a local event or, testifying, often we have 3 to 5 minutes, right? And how do we take that 10-year journey and break it down into that 3 to 5 minutes? And when we're thinking of advocacy, sometimes it's a little bit easier because we know what we're advocating for, right? So we can find that moment. But maybe someone's just asked you to share as a family member. What we've done here is given you some prompting questions to help you find those 1 or 2 moments, right, that you can share. It doesn't mean that the whole journey is not important, but how can I be most effective? And this should help you frame that story, if that makes sense. We've written a few here. I'm sure you might have your own, but really, really helpful in trying to frame that short story. I could give you a few minutes to just look over this, but we are actually going to give you some time. So what we thought we would do is maybe we could take 2 minutes, excuse me, keep this slide up, and ask you to take 1 or 2 of these questions and kind of reflect on that journey. And then let us know what that felt like. Was it easy for you to come up with a prompting question? Do those moments make it easier? So I think we'll take those 2 minutes right now and ask you to do that. And then we'll have you enter in the chat room how that felt.
Yeah, I want to echo that a little bit, that, I think, we're all passionate people, right? And sometimes we can identify easily hundreds of things to advocate for and to change. And and I've talked to elected officials and decision makers, and they'll say, you know what, I don't really know what you want. Because we just kind of, and so part of telling your story is about messaging and being clear about what you're advocating for. Because if I told my entire recovery story, and then didn't even ask for something, people would get lost in it, and we hear that from elected officials all the time. They're like, I hear from a lot of family members, or I hear from a lot of people in recovery, and I'm not really sure what you're advocating for. And so some of it is about organizing together. And we have some great examples of some family members that are going to give examples of that later. I think that some of these prompting questions, like you don't want to like answer all of these in your story, right? Like you might pick like one or two that really help shape an effective message. Even if you have, 5 to 10 family members in your county, for example, and you're advocating together, well, how can your collective stories best have a strongest impact together, right? And so part of this is storytelling, yes, but also about effective messaging. Are we really being heard if we're sending out 1,000 different messages on 1,000 different issues? That's an important question to ask ourselves. And so how do we hone that message and bring our stories together to be most effective? Denise, did you want to, I know some people.
So when you get a chance, look in the chat, but again, it was that experience, for one person in the chat, it was about poverty, that denial of insurance, right? And that family, that financial ruin that they experience. For another family, was just begging for help. Every door closed. I think as family members, our journeys are very different, but so similar when we hear about those barriers in this failed system of care. So thank you, everybody, for putting that in there. And you'll find your place. These are here just to help you reflect, to think about that moment. And I thank you for taking the time with us to do that. And we are really looking forward to looking at all the chats when we can, after the webinar. We can go to the next slide. Personal versus public narrative. Again, we keep on repeating this. You don't have to tell the full story. In fact, you probably won't have more than that 3 to 5 minutes. Best to use examples, 1 or 2 moments of your story, those prompting questions. And then match your story, possibly if it's not personal, maybe you're just starting to be an advocate, maybe you're it's something you're really interested in, thought, wow, you know what, I never thought I could be an advocate. Here's the wonderful opportunity, right? To share that personal experience and match that with a piece of legislation that's out there, that should be out there. Maybe it doesn't exist yet, right? When you think of RAP and the state teams and those listening sessions that many of you are on, what I heard in sitting in one on the West Coast was, we don't have this, we need this, it's critical. So match it to that advocacy opportunity.
And if I could just jump in there,
Sure.
Denise, for 1 second. I think it's really important with the pieces of legislation that are pending, and there are a lot of groups like RAP, like the partnership, that highlight those pieces of legislation and what their focus is, either on the state and local level or on the national level. And being able to match a piece of your story to that legislation really gives it lift. So, for example, if we're going to hear in a little bit about some efforts that David engaged in on the local level in Delaware to really help change the law. Denise and I have been very involved recently in getting families and individuals to advocate for pain management alternatives to opioids, so that someone having surgery doesn't only have an opioid to look at. And hearing that personal story of how it can affect someone's family really changes someone's point of view. Or hearing about how access to naloxone can be a lifesaver and how that impacted someone's family, particularly. Those kinds of personal stories for that specific policy ask really make a huge difference. And that way it kind of cannot be so overwhelming. You're really just narrowing in and saying, we know that we've got a million things on the to-do list to really change policy to be more responsive to addiction and substance use disorders in this country. And here's one of them, and my story matches, and I'm gonna lend my story to this effort. So just some more food for thought on that.
Yeah, and just to piggyback, maybe you don't know what that advocacy issue is. We're here to help you. Marcia just spoke about the work with, the No Pain Act. We are working on the X waiver and trying to promote that. We have the Family Services Act. There's a piece of legislation, I assure you, that matches with your journey. So especially as a new advocate, maybe I don't have time to figure out what's going out at the federal and state level, but I know I want to be part of it. Reach out to us, reach out to Aaron, to RAP and to us, and we'll help guide you and let you know, especially with all the new legislation being reintroduced now. So thank you. Next slide. I wanted to share a couple of, I keep on saying this is a we thing. I have to get better at that. But we wanted to share some personal quotes from some of our volunteers. Especially if you look at Lorraine's, right? This is one of our advocates, Patty, testifying in front of Congress. And then we have Lorraine, and really something to, I have the chat over the text now, I'm sorry, but for Lorraine, it was really important that she share her story, that she be part of change, but what she found almost like organically, that waterfall effect of what a bigger community and family she was connected to. So really grew her peer network. When we first started this webinar and I saw all the faces that I knew, it like fills my heart, right? It's the silver lining to this somewhat heartbreaking journey we all share, but we met each other, and it's that peer support. So I wanted to bring that out as well. We can go to the next slide. And Marcia, I'm going to turn this one over to you.
Yes. So, as we were talking about before, with different opportunities to share your story in writing, that can somehow feel safer, and you're in the driver's seat and in control. Just tossing out a couple of things. We have an advocacy toolkit, and we can send out a link to that after this webinar. But you can find out more about all of these options in that advocacy toolkit. But some things are letters to the editor. So if you see that in your local newspaper, they're using sort of disparaging language and saying junkie and addict and those sorts of things, and you want to educate, write a letter to the editor. And every newspaper has their own guidelines about word length, and but it's usually in response to something that publication has published. An op-ed can really be a longer form piece on the need for action in your community, and that can be where you really infuse your personal story and policy together. You can call your member of Congress or your local representative. You can attend a town hall or offer testimony for every meeting. Even if you're not someone who's testifying, you can always submit written testimony. So there are a ton of different ways, and all of us are happy to help work with folks to figure out the opportunities that are out there. But I would encourage you to look at our advocacy toolkit, and RAP has one as well that's really great. Mm-hmm. So these will outline more of those opportunities.
Thank you, Marcia. We could go to the next slide. And here we have David Humes. So David is a fellow advocate, friend, a very strong voice for families. And we've asked David to join us. And if you reflect on all the slides that we just did, and asked him, to share his story on one of the advocacy efforts that he is working on, so that you can get a feel and take this long journey and see what it visually looks like, and of course audio, that we can do this in 3 to 5 minutes. So thank you, David. We are so glad you're here with us, and thank you for your generosity and your time today.
Well, thank you for having me, number one. Briefly, my story is I'm a person in long-term recovery, but the reason I really do this is because I lost my son, Greg, to an accidental heroin overdose back in 2012. I met with the investigating detective after my son's death, and he said, if we had a 911 Good Samaritan law or Narcan law, your son might very well be alive today. And in the aftermath of my son's death, I knew I wanted to do something, and my vow to him was somehow to save a life in his name. And those words from the detective kept coming back into my mind. If we had a 911 Good Samaritan law, or a Narcan law, your son might very well be alive today. I was also very fortunate to be led to the doorsteps of 2 people in Delaware who were starting a group that was going to be an open, transparent group to take action against this, what we've been calling the public health crisis of the 21st century. And we were just just a bunch of moms and dads, like a lot of people on here, deciding what to do. And we decided that we would try to get a 911 Good Samaritan law passed in the state. And we were very successful doing that. We followed up the following year, and we looked to get a community access to the Narcan law passed here in the state of Delaware. We were some of the earlier states to get both of these laws passed. And right now, we found out through some of our additional work that as good as we thought our community access to naloxone law was, that we didn't actually have protection from liability for lay people to administer naloxone. And because of that, some organizations, restaurant associations, contractors associations, their insurance carriers would not let us train those people on site because of those liability issues. So we are working on, we have a bill about to go to the House floor in the upcoming month to close that loophole there so that we can have more people getting naloxone here in the state. And to make sure that they're not afraid to administer because of liability issues. And we want to save more lives. So our statistics here in this state are such that 79% of the people who overdose, not die from overdose, but overdose, do it in a private residence. Only 7% of those residents are equipped with naloxone. And we know that's not the end of the problem, but it keeps people alive so that we can have them and get them treated. And when we talk about advocacy, one of the things early on after the loss of my son, Greg, I told people, don't treat me like some poor SOB who just lost his child. Treat me the same way you've always treated me. And don't be afraid to talk about my son, Greg. These are some of the things that drove us and some of the things that our advocacy group is doing here in Delaware. As I signed on to the meeting, I saw somewhere in these floating boxes, there's another really strong advocate here from Delaware that's on this, Mary Beth Chikaki. She lost her son, Matt, in 2015, and she's been very supportive of all these efforts that are going on here in Delaware. So thank you very much.
Thank you, David. We appreciate you. And thank you for the great work that you're doing, both nationally and at the state level. We could go to the next slide. And Aaron, you can take this slide.
Yes. Thank you, Denise. Thank you, David. We are going to dive deeper into actual language on the next webinar, but just to give you a little glimpse of what that might do. We do language trainings all the time for people in recovery, family members, supporters. And a lot of times we use language that we actually don't even realize could be harming our message. And so, and it's about perception. It's about how other people hear it, right? So we want to be thoughtful about any language that could be harmful. That does matter. The way people hear the word addict or junkie, like as a person in recovery, if I'm talking to somebody else in recovery and I say I'm an alcoholic or an addict, there's like a bond there, right? We know what one another is talking about. But if it's out in the public, people hear that very differently. And so it's about perception. And so we want to be careful around some of the language that could potentially be harmful in our messaging and in our stories. And so we do have trainings for that that we'll do in the future, really focusing on language. And so it is about that perception and how it's heard. There's a phrase called a person-centered language, right? And so as opposed to addict or junkie, person who has substance use disorder or person in recovery, right? Like that's why you hear a lot of people use that sort of language. We are people first, right? And so using person-centered language is a good stepping stone there. And shifting messaging strategies with barriers faced in previous advocacy experiences or campaigns. We have somebody who's going to share sometimes in advocacy, you kind of have to shift your message, shift your storytelling. We learn things. Recovery Advocacy Project is at the end of our second year. We learned a lot from just advocating within our first year. And so if we can always grow as a community, if we can always grow in with our language and our messaging, and to strengthen that in our organizing, and learn from what doesn't work, we should not be repeating the same things over and over and over, right? And so we have somebody that's going to share with us, Cheryl from Team Sharing in Massachusetts, who has a great story. We talked earlier last week, and it's just such a great example of how effective messaging and changing strategies, and mobilizing people on the state, on the local level to have an impact in their state. And I just feel like Cheryl really kind of marries a lot of what we're talking about today. And so I want to turn things over to Cheryl from Team Sharing in Massachusetts. I'm originally from Rhode Island, so a former neighbor, anybody in New England, I always love listening to. So Cheryl, the floor is yours.
All right, thank you, Aaron. So I have 3 minutes. Okay, boy, this pressure's on. So my name is Cheryl Jouer, and I lost my son Corey to an overdose February 24th, 2011. And for the next few years, I suffered in my grief alone until I met a few other mothers. I formed a group called Team Sharing, which has since become a national organization, and we have 22 state chapters as well, and it's all for parents that have lost a child. Over time, I have seen the stigma that has been presented to us for those that have lost a child. And so last year, I saw the president lowered the flags to half staff for all those that have died from COVID, as they should have. And I thought, why can't they do that for us? All those families that have lost a child, they need to know that their child mattered. And that was really, really important to me. So we went on an initiative last year to get our governors to lower the flags to half staff. And I created an event, and we went full force, and we got about 5 states that did that. But that was it. Most of the governors were just saying, no, no, no. North Carolina lowered the flag for George Floyd, which as well as they should have, but again, no to us. Tennessee lowered the flag for Charlie Daniels, a country western singer, but no for us. So the more no's we were getting, the angrier we were getting. And their lives mattered, and I'm not gonna stop until this country knows that their lives mattered. So that didn't work last year. So like you said, Aaron, we changed our thinking. And this year what we did was we started early, and we started creating, asking people to reach out to their legislators to create a bill, because that way we could bypass the governor as long as we have two-thirds of the vote. So in this group called Fly Our Flags at Half Staff on International Overdose Awareness Day, we have about 1,000 people in there right now. And this one mom just came in and she said, what do I do? I said, just call up your local rep, and all you need is one person. And long story short, in Utah, Lisa Thompson created a bill called Landon's Bill. And so on August 31st, 2021, the flag in Utah is going to fly at half staff, and it's going to be called Utah Overdose Awareness Day. And that's just one. We have about 15 of them in process right now. But not only did we do that, I called my congresswoman and I asked her if she would support a resolution and if she would write a letter to the president asking him to lower the flag and declaring August 31st Overdose Awareness Day. And that's where we're at.
Thank you, Cheryl. Thank you, David. And I've seen the chat as well. For all the families here that have lost their children, we thank you for your selfless work. And we mean that at the partnership. And I know from RAP too, you fill our gas tanks and remind us of the work that we have to do every day so that another life isn't taken. And we appreciate you. And we thank you for the courage to share today and out there in your own communities and at the state level. So I just wanted to thank you before we went on to the next slide. See, you could be authentic. I really do appreciate you guys. This is a project that we're working on, and we just wanted to plant some seeds with you guys since we had so many families here. We are working on a project that is really looking at that broken system of care, especially for families, and the many different touch points. Some of them we hit today. We talked about naloxone, we talked about parity. There's prevention points. There's also points where, let's say your loved one is struggling and they've just left treatment, and us poor families that haven't been educated yet, like we think, okay, we're done, right? One and done, they're fixed, like another medical condition, when we learn that there's no wraparound supports or no continuum care. So the journey is long. And so what we are doing is taking those touch points, and sadly, we have 50 or 60 touch points already. And we are going to make a call for stories. We have many already that take that broken system, that challenge each one of those touch points and match them to a story. We do this for many different reasons, but we want, again, our families to know they're not alone, maybe to see that whole journey, but to inform policies so that our stakeholders and our members can look at this, see that, match it up with their legislation, and see that human story behind it, right? To lift, put life into that legislation. So we did want to share that with you. These are a few stories we're calling for now. You can email us anytime, but we did want to share that with you because I think so many families, right? Especially when we early on that touch point and we find out that our loved one is struggling. We don't know that this could be a marathon, right? Sometimes we think it's that sprint and we're going to get them treatment and everything is going to be okay. Well, shame on society and so much more that we have doors closed on us at every turn, and there is a lack of supports and a lack of funding for families. So a really important project we're working on. We can go to the next slide.
Just before, in case
sure.
folks wrote down Denise's email address at the bottom there, I think there's an extra O in there. So just, yep. So if I just want to catch it just so Denise would actually get any emails that anyone was sending.
Mm-hmm. Thanks, Marcia. Some next steps. Aaron, you want to share a little bit about where we're going with our next webinar for a minute?
Yeah, we've done a lot of state-specific trainings around language. There's a great language training that was developed years ago called Our Stories Have Power, and that it's a great, like, almost advocacy 101, right? To really focus around language for both people in recovery and family members. I think we'll pull some stuff from that training. But really, we talked about, the importance of telling your story. We talked about the timing of telling your story, the impact, whether it's healthy for you or not at the time to tell your story. Sometimes we're kind of thrown into advocacy. I saw some stuff in the chat where it's like, this happened in my life. There's, whenever there's discrimination or stigma or barriers, that there's a door for advocacy and telling your story. But making sure that you're in a healthy space to be the one that shares your story is really important. And so, so we kind of covered a lot of that today, but we really want to focus on some of the language pieces more in depth and dive deeper on that on the next webinar. We'll have the date of the next webinar and the registration. We did a follow-up survey after the family webinar that we did last April. I thank you for participating in that. And then we will have some links in the follow-up email that you'll get that will have a recording of this training that you can share, and also ways you can sign up for action alerts, with partnership or recovery advocacy project or both, and take actions that speak to you. You know, I think a lot of times we kind of feel this obligation to like do everything. And I know when I'm doing like 5 or 6 different things at once, I'm not really like doing one of them effectively. You know, I'm kind of all over the place. And so it's all right for us to, you know, take care of ourselves and not sign up for everything and not take every action that comes our way, but know that those actions do add up, right? You know, if we can sign a petition or write a letter, if it speaks to us, or write a letter to the editor, all of that adds up. And so however you learn best and practice best, I hope that this might be a beginning for some of you. And Denise and Marcia and myself are always available. People are asking me if I do travel and will I fly in the chat, and I was like, that's great. And so yes, when it's safe. And so you know, we do a lot of trainings that are state specific, but the next webinar is going to be around language for everybody, and I think it'll be really helpful for people. So
Yeah.
stay tuned.
And just to piggyback on the families that are with us today, the recovery community has done such a wonderful job in changing the narrative, right? Our families are a little bit behind now. We families are stigmatized. So part of this training will be that stigmatizing language against families, right? That the label that we all get to share of that enabler and that codependent. So really, this is going to be, you know, in addition to the recovery and how we share our stories, it's really going to put a spotlight on families too. We've never had that language conversation, right? And maybe maybe as you think of those moments, maybe that's what you want to share, right? For so long, I felt judged and shamed and labeled. So we hope you families come back, and so that we can model what the recovery community has done for us families. So thanks for that. We can go to the next slide, Aaron. Thank you. I am going to close my chat. There are emails. Reach out to us anytime with questions. If you want to share your story, maybe you're not ready, you know, feel us out. We're here to help you. We are so grateful that you're here today. We're so grateful to be having this discussion. If I think back, and Aaron, you know, said we've been working together, what, 10 years now?
Yeah.
Who thought we'd be here having this bigger conversation with multiple communities. And again, Cheryl and David, we thank you and appreciate you. So thank you.
Just to put in one last plug, if folks want to follow both of our organizations in social, that's a really easy way of keeping tabs on what's going on, and also, you know, as people tiptoe into advocacy and finding their voice, even just sharing those posts from both organizations in social is a nice way to begin that journey. So just a plug for that as well.
Hey, thank you, everybody.